osteoarthritis a disease of wear and tear? Well, that's what I learned in medical school 30 years ago. Now we know better, and the answer is no. Osteoarthritis is not a wear and tear of the cartilage. The cartilage is this layer that protects the bones. Today, I will explain to you what osteoarthritis is and what you can do to prevent it and improve the pain from it. So, let's talk about osteoarthritis. Osteoarthritis is a condition that affects the cartilage that protects the bones. But it's not caused by putting too much weight on the joint, using the joint, moving the joint, or exercising that joint. We used to think that too much weight was the cause of osteoarthritis because the most affected joints are knees and hips. But the true cause of osteoarthritis is not that the person is using the joint too much. People can have osteoarthritis in any joint of the body, even the shoulders, the hands, the fingers, the neck, anywhere. Osteoarthritis is caused by a slow, low-grade chronic inflammation. Inflammation means that the immune system is sending cells and they produce substances that destroy the cartilage. But what causes this chronic inflammation? And does anti-inflammatory work? Well, nobody knows exactly what causes this chronic inflammation. There are genetic factors involved. There is new knowledge that the fat tissue in our body, known as adipose tissue, produce adipokines. The first adipokine was discovered in 1994 and it's called leptin. Now, scientists have discovered more than 100 types of adipokines. These adipokines are produced in the fat tissue of our body, so obesity leads to osteoarthritis, but not because it puts more weight on the joints. If that was the case, obese people would have osteoarthritis only in the weight-bearing joints. But they also have OA in the hands, neck, and other joints of the body. The adipokines, when in excess, they create a pro-inflammatory state in the body. Then this pro-inflammation is what starts destroying the cartilage, little by little. We know that obese people who lose weight improve their symptoms of osteoarthritis, and the reason is not because they're putting less weight on the joints, but probably because they are producing less adipokines. Before I continue, please remember that this video is for educational purposes only and is not intended to replace medical advice. And if you have osteoarthritis, please talk to your doctor. And if there is an emergency, please go to the nearest emergency department or call an ambulance. This takes us to the second factor that helps osteoarthritis, movement. You probably heard me saying this many times. Motion is lotion. Yes. Moving the joint, putting weight on the joint, using the cartilage is really good for the health of the cartilage. I use the analogy of honey. If the honey is crystallized and cold, it's sticky. But if you stir it up and warm it a little bit, it gets fluid and clear. That's what the synovial fluid in our joints does. The more we move, the more synovial fluid is produced and the nutrition to the cartilage is brought by the synovial fluid. When the person puts weight on the joint, the cartilage absorbs the nutrients that are in the synovial fluid. Astronauts who go to space do not put weight on their joints because there is no gravity in space and their joints have less fluid and the cartilage is thinner. On the other hand, people who practice sports and do a lot of physical activity have thicker cartilages in the joints they use most. This shows that moving the joints is good for a healthy cartilage. I have various other videos showing exercises for osteoarthritis of the hips and knees, dancing, going up and down stairs, and for osteoporosis. Third, the pain that people feel from a joint with osteoarthritis is not a good measure of how much damage there is in the joint. A person can have very tiny osteoarthritis and a lot of pain. Another person can have super severe osteoarthritis and do not have any pain at all. Here are some examples. Look at this neck x-ray. There is almost no osteoarthritis, but the person has a lot of pain. Why is that? This person may have other problems around the bones. It could be the pain is coming from the muscles, like myofascial trigger points. But it can also be that there is a little bit of pain coming from the osteoarthritis. But when these painful impulses enter the spinal cord and passes through the brainstem and goes to the brain cortex, it is amplified. That is because this person has central sensitization. Their pain system is sensitized, so their pain is amplified. Not only that, but this person may also have lost the ability to block the pain. Did you know that we have our own endogenous pharmacy? Our brain is able to suppress pain by releasing powerful opioids like endorphins, enkephalins, and dynorphins. But some people have lost the ability to suppress pain. So in this case, this small painful impulse from this tiny osteoarthritis gets amplified in the spinal cord, it gets amplified in the brain cortex, and is not suppressed here in the brainstem. So guess what? The person interprets this pain as very intense pain. And yes, they feel it. It is real pain. But the volume is turned up. Here is another person. This is a 92-year-old male who fell, hit his head, was taken to emergency, and they x-rayed his head and neck. Fortunately, he did not have any neck fracture or head injury. But the neck x-ray showed very severe osteoarthritis. It lost the normal curvature, there are lots of osteophytes, no disc space, and the facet joints are very narrow. So this is terrible, severe, advanced osteoarthritis of the neck. But did you know that this person never had any neck pain, not even one day of his life? Yeah, so here, what is the solution to this problem? If you have pain and you were told that this is due to osteoarthritis, here are some practical things for you to do. First, think seriously about losing weight. Even if you lose a few pounds or a few kilograms, the number of adipokines your body will produce will reduce immensely. And maybe this will reduce the progression of your osteoarthritis. Second, start exercising. The more you move, the better the nutrition to your joints. I highly recommend water exercises. You can move in all directions, there is resistance and cardio training, and you can relax in the water. But if you do not have access to a pool, a lake, or a beach, then just start moving, dancing, playing sports, walking, biking, anything. Remember, motion is lotion. Third, it is important to avoid central sensitization. There are many mind-body therapies that help to retrain the pain system. You may watch my other video where I talk about these therapies. And last, eat healthy, especially an anti-inflammatory diet. This means more fish, olive oil, omega-3, fruits, vegetables, and less processed foods, white flour, and sugars. I have a video with more details about anti-inflammatory diets. I also have another video about omega-3 and another about turmeric. Turmeric has some anti-inflammatory properties and it's great in Indian dishes, soups, chicken, and rice. Well, There is a button here for you to share this video. Send it to anyone you know that has osteoarthritis. And thanks for watching. Goodbye!